Hello everyone. In today's Explain Why series, we are going to understand an important concept, and this can be asked in the Viva also as well as in the theoretical papers. So what is that question is why glucose appears in the urine even before its Tmax is reached. Tmax means it is a maximum threshold with which the nephron can reabsorb the glucose. Even before reaching the maximum threshold, the glucose starts to appear in the urine. So what is the reason? Let's try to understand. So first let's see what is the transport maximum of glucose. A nephron can maximally reabsorb 375 milligram per minute. But in our body, the glucose levels are measured not in milligram per minute, it is measured in milligram per deciliter. So first we have to understand how this 375 milligram will be converted into a deciliter form. So as you can see here, 375 milligram per minute is the value for the maximum threshold. And we know that glomerular filtration rate. So what is the glomerular filtration rate? It is nothing but 125 ml per minute. So what is going to be the end value? End value is going to be 3 milligram per ml. So the nephron can reabsorb the glucose up to 3 milligram per ml. But again, when you convert this into deciliter, it will be 300 milligram per deciliter. Deciliter is nothing but 100 ml. So the ideal renal threshold is 300 milligram per deciliter. So the transport maximum was 375. Now we found out the ideal renal threshold it can operate is 300 milligram per deciliter. So what does this 300 milligram per deciliter mean? It means that whenever the person's blood glucose level goes beyond 300 milligram per deciliter only, it will appear in the urine. But all of us know that this is not the case. Whenever the glucose level goes beyond 200 also, it starts to appear in the urine. So why there is a huge difference between the original ability of the nephron and the actual functioning of the nephron? So the answer is pretty simple. So in the class also, whenever we are teaching, not everybody receives it to the same levels. In a similar manner, all the nephrons does not have the same maximum renal threshold. Some of them are going to be average performers, some of them are going to be slow performers. So the nephrons are not equally functioning at an ideal level. So this difference between the actual value and the original threshold, that difference between them is called as the splay. So this splay concept can be asked anywhere. This is very important concept. So as you can see here, they have plotted the plasma glucose. So whenever plasma glucose is increasing on the x-axis, what is happening? And here they can see that glucose reabsorption. And they have drawn two curves. The dashed lines is the ideal situation. And all of us know ideal situation is not going to work out anywhere. The actual situation is even below that. So this difference between the ideal situation and the actual situation is called as splay. So if you tell it in one word why the glucose is appearing before the renal threshold is reached, it is just because of the concept of the splay. There is actual difference between the original level and the actual levels. So that is called as the splay, concept of splay. I hope it's clear. Thank you for watching this video. If you have any other explain why doubts, kindly drop it in the comment section. I'll be happy to do a video on it. Thank you so much.